This is Jerry Hesch, Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And my client injured her tailbone. How old were you?
I must have been 4 or 5.
Okay, and how did you injure it?
I was playing with a wagon. I was standing in it, and I was scooting it forward because I was trying to roll somewhere. And it went off this little step. And so I flew back because it flew out from under me, and I landed right on my bum.
Ouch. Ouch. I'm sure it hurt.
Yes, it did.
Did you have tailbone pain at that time?
It was very slight. It was sore from the fall.
Okay. Okay. Now when I palpate the bottom of the tailbone, do you have any tenderness?
No.
Okay. When I palpate on the left side, do you? You jumped a little bit. All right. And what about when I palpate the left side?
No.
No. So you do have pain in that area. There is a ligament on both sides called the sacrotuberous ligament, and it attaches partially to the coccyx, but mostly attaches to the sacrum. And I'm not able to discern a difference in the tone of this ligament in comparison to the right side. It's too subtle for me. But when I palpate the sacrospinous ligament, which is a lateral ligament, I feel more tone. My left thumb is higher towards the ceiling. And when I spring that ligament on the right, I get a little bit of spring mobility. And when I try and spring it on the left, it actually feels like bone. Okay? And when I palpate each side of the tailbone, on your left side, my finger is higher. Would you capture that camera and make sure we can see this difference? Maybe a top-down view would be good. Can you see that her left side is higher?
Yes. Let's go here.
Very good.
Yeah.
And that's the sulcus on each side of the tailbone. And the tailbone has lateral wings, and so here's the tip. And so if it's side bend, then that wing goes up on the left, and that's why we have a deeper sulcus on the left side compared to the right. Then the other thing that I do is I come on the tailbone and I spring it to the left, and there's movement happening. And when I try and spring it to the right, there's no movement. So I think in good faith we can name this a side bent coccyx. The correction is a one-time correction. You do not need to come back and see me repeatedly. And the correction is very simple. I developed this treatment. Very few people are aware of a side bent coccyx, but the research shows that it does side bend. It has more forward and backward movement, so a lot of people focus on that movement. There's very little in the literature and very little in social media on a side bent coccyx. Okay? But the way that I treat it is I isolate the tip of it, and then I come and I capture that sacrospinous ligament on the right, and I put the heel of my hand there, and then I just push into it to a natural stopping point, and I stay there for 3 minutes. Then I come onto the left side of the tailbone, and I push into it firmly. It doesn't move, so I'm pushing up against a stop, and I'm pushing it almost purely to the right. There's a slight angulation of my force. My elbow is a little bit lower, so it's not, this would be a horizontal force, but it's more, there's about a 15 or 20 degree angle. And I do that for 3 minutes. Okay? Now, I will treat you, and then we'll come back and we'll film the response to that.
Okay.
Prior to treating it, I'm going to have you go sit in the chair for 30 seconds and see how you feel. But the other thing that I want to do is the body has a reflex. And when you have an asymmetry that's induced in the lower body, such as through trauma, then somewhere in the upper body, you are going to have a compensation in the other direction. So what I want you to do is lay on your back, and I'm going to evaluate your upper neck. So I have my index finger. I'm not going to show it. I have my fingers right below your ear, and I find that big bump, which is the mastoid.
Mm-hmm.
And I'm going to lift up on the left side, and I can easily side bend your head to the right. And now I'm lifting up on the right. What do you feel?
Just pressure, it's not moving.
It's not moving. It's not moving. Okay? So it makes sense that if your tailbone is side bent left, that you're going to compensate somewhere with side bending to the right. And in fact, your right mastoid is lower, and I can't lift it up. I can't induce left side bending. So this is a reflex. I don't have to treat your upper neck.
Mm-hmm.
When I restore movement to the coccyx, I predict that this compensation in the upper cervical will automatically release, and that's working with a reflex.
Yeah.
I could do a lot of work on your upper neck, but next day you'd come back, it would still be stuck.
Mm-hmm.
Next day after that, still be stuck. You cannot fight Mother Nature. You can only work with her.
Mm-hmm.
Maybe I could fool her temporarily, but I couldn't fool her for 24 hours.
Mm-hmm.
So the concept is treat the lowest denominator, and we've screened your lower body. We already treated your limited hip extension and your tightness in your left patella. We treated those, and then we found the tailbone, and this upper neck will release. That's my prediction.
Okay.
So good. I'm going to treat that tailbone in the manner that I demonstrated, and let's go ahead and stop the filming. Thank you.